What are the signs and symptoms of implantation bleeding?
Hello everyone! Today, we're going to talk about a topic that's particularly relevant if you're trying to conceive: implantation bleeding. This is a physiological process that can happen after a fertilized egg attaches to the lining of the uterus. Implantation bleeding is often one of the first signs of pregnancy, but its symptoms can be subtle and easily confused with a regular period. So, let's dive in and explore what you need to know.
What is implantation bleeding?
Implantation bleeding is a light spotting that can occur 6 to 12 days post-ovulation when the fertilized egg attaches itself to the uterus lining. This process can cause a small amount of blood to be expelled from the body, leading to what we refer to as implantation bleeding.
What are the signs of implantation bleeding?
Now, let's talk about the signs of implantation bleeding. It's important to note that not all women will experience this, but if they do, they might notice: 1. Spotting or light bleeding. Unlike regular menstrual bleeding, implantation bleeding is usually lighter and lasts for a shorter time. It may appear as a light pink or brown discharge. 2. Cramping. Some women experience mild cramping similar to menstrual cramps during implantation. However, the intensity of these cramps tends to be much less than those experienced during a regular menstrual cycle. 3. Timing. The bleeding generally happens about a week or so before the expected menstrual period. This is approximately the time frame for implantation after ovulation and fertilization. Remember, these symptoms can easily be mistaken for the start of a period, especially if a woman has a regular cycle.
How is implantation bleeding different from a regular period?
So, how can you differentiate between implantation bleeding and a regular period? Here are a few key points to remember. 1. Color. The discharge or bleeding from implantation is often not red like a typical menstrual bleed. It's usually a light pink or brown. 2. Duration. Implantation bleeding generally lasts for a few hours to a couple of days, which is shorter than a regular period. 3. Flow. Implantation bleeding is usually lighter in flow compared to a menstrual period. You'll notice only spotting or light bleeding. 4. Associated symptoms. While cramps can occur with implantation, they're usually less severe than menstrual cramps. Also, many women experience other symptoms such as breast tenderness or nausea around the time of implantation due to hormonal changes. In conclusion, implantation bleeding can be one of the first signs of pregnancy, but it can be easily confused with the onset of a regular menstrual period. Remember that every woman's body is different and not everyone will experience implantation bleeding. If you're unsure about whether you're experiencing implantation bleeding or a regular period, it's always a good idea to consult with a healthcare provider. We hope this video was helpful in understanding more about this topic. Until next time, take care.